needed for taking the vital signs. Okay. So we're going to take first TPRBP. So that is the acronym. So T for temperature, P for pulse rate, and then respiratory rate, and then the BP. So that is the correct way of taking the vital signs. So first, we're going to get the thermometer. In proper cleaning of the thermometer, so since the thermometer is not yet used, so we have to get cotton balls with alcohol. So from the bulb, this is the bulb, going to the stem. Since this is not yet used, so the patient's thermometer is clean. Okay? So from the cleanest to dirtiest in rotating manner. Okay? So the cotton is with alcohol. Okay? So that is how we clean the thermometer. But after the patient's thermometer is used, so we should clean the thermometer from cleanest to dirtiest. Since this is the part that we put in the axilla of the patient, so this is considered the dirtiest. Okay? So we have to clean it from the cleanest. Okay? In rotating manner, do not put the cotton back and forth. No. So it must be in rotating manner, then discard the cotton balls. Okay? So that is how we clean the thermometer. So we're going to put the thermometer in the farthest axilla of the patient. So sir, I'm going to put the thermometer in your axilla. In the farthest part of the extremity, ha? Okay? So since this is a dummy, so we cannot put the thermometer in place. But if you're a human, definitely you're going to put the thermometer here and then place the elbow or the arm in the chest so that it will keep the thermometer in place. Okay? So that the position of the patient must be like this. And then we can now, while waiting for the thermometer to finish, because the thermometer will be read after 7 minutes, so we can already take the pulse rate. Okay? In taking the pulse rate, we have to consume 1 full minute. Okay? So it must be in line with the thumb, using the 2 fingers. Okay? Count. After 1 minute, you already know what is the pulse rate of your patient. But do not remove your hands while taking the respiration of your client. Because, why? If you remove your hands, so he will be conscious of her respiration. So the tendency of the client is to hold his breath. So the correct way of taking the respiration is hold the patient in the pulse, where the pulse is, and then count for the respiration of the client in 1 full minute. So since the patient has a normal vital signs, so the patient can proceed with the proper bed bath. Okay, so the first thing that we have, the next thing that we have to do is oral care. So in oral care, so these are the materials needed. So of course, the position of the patient should be in semi-Fowler's position. So we have to put the patient in semi-Fowler's position. Pause. The patient is now on Fowler's position. So if the patient is able to do his mouth care, then let him do the toothbrushing. Okay? So we can give the toothbrush with the toothpaste. And then let him do the toothbrushing. So if not, so we can give him all the materials needed. So he can pour the dirty water here. Okay? But if the patient is not able to do his mouth care, so you will be the one to do the mouth care for him. So if the patient is bedridden, then prepare for a water, then a mouthwash, water, then mouthwash, and then a tongue depressor with gauze pad. Okay, so we're going to dip the gauze here, and then you do the mouth care for the patient. Okay, so like this. So that's how you do the mouth care for the patient. Okay. So then remove this, then change until the patient's mouth is clean. Providing the mouthwash for the client, then the next one is shaving the client. So in shaving the client, you will need water in the basin. So the water must not be too hot or not too cold. In checking the temperature of the water, so you're going to use your elbow. Okay, check. And then get one towelette, put it on the chest of your client. Then wet your client's face by using this towelette. So wash, drain, and dry. Drain and drain. Okay, so wet the patient's face. Okay. After that, get the shaving lotion, shaving cream. Okay. Put it gently to your patient's face. Okay. Apply. After that, get the shaver. Start shaving your patient. So in shaving your patient, you have to pull the skin of your patient. So pull. Okay? And start shaving your patient. So the shaver should be towards the patient's hair growth. Okay? Para hindi masakit. So kung paano yung ayon ng tubo ng hair, so dapat paayon ang inyong pag-shave. So in this part, so the patient should be shaved like this. Okay? O ganon. Okay? Kung dito sa part na to, ganito naman. So hindi dapat masakit para sa patient. So kung dito naman sa part na to, sa may baba, so dapat ganon. Okay? Ganon kasi ang growth ng hair sa patient. Okay? So after that, wash it with a wet towel, wash and drain, and then clean the area. Okay. Then pat it dry. After the patient's skin is dry, then apply the shaving lotion. apply it to the patient's face, and then that's it. Then remove the gloves. In removing the gloves, so it must be like this na. Then the garbage can. After the shaving, so first attend to the client's personal needs. So ask the patient if the client ask him if he is defecating or urinating. If the answer is yes, then you have to position the patient and remove first the top sheet. Okay? So remove the top sheet and fold it into square, to a big square. Okay. So after you have folded the blanket into a big square, then put it in the client. Okay. And then apply, put it in diagonal position. So this is the diagonal position. The tip and the tip is here. Okay, that is the diagonal or diamond. And then undress the patient's pajama or trousers. So remove the trousers. Remove the trousers or pajama. So put the patient, put the gloves or wear the gloves. After you have worn gloves, then put the patient or place the patient in dorsal recumbent position. So flex the knees of your client. Sir, in the count of 3, please flex your legs. 1, 2, 3. Then the other legs. 1. In the count of 3. 1, 2, 3. So that is the dorsal recumbent position. And then put the bed pan. So you're going to open just only the tip of your blanket. Okay? So then put the bed pan. Okay? In the count of 3, so ask the patient to lift her his or her pelvic area. 1, 2, 3. Patient is going to defecate, then leave the patient for a while for privacy. So for the male client, it is going to urinate only, then you can offer this urinal. Okay? And then if the patient is a female, then you can use the bed pan. Okay? Are you done with your defecating? So if yes, then you can fold the blanket and then so if the patient is through in doing his personal thing, then you can check the patient's output. Okay, so just roll down the blanket and then check for the output. So check for the consistency, the amount, the color. So then you have to document it. And then you can pour water for the patient. So check again the water if it is too hot or too cold. So pour water for the patient. So for now, we're going to clean the patient's perineal area, female perineal area. Okay. So pour water. Okay. After pouring water, so as much as the patient's perineal area is clean. Okay. And then you can if there is a pieces in the bed pan, you can place a tissue so that it will not sprinkle in the patient's perineal area. Okay. Set. get, before you get the cotton balls, so complete the assessment for the patient. So check the bulbar area. So if it has redness, swelling, or irritation. So do it at once, okay? Then get the cotton balls, okay? Then dip it in water, okay? So squeeze a little in the cotton balls, and then start cleaning the mons pubis area. So the mons pubis area is this top, okay? From top to bottom. Okay, from here, in the mons pubis, going downward, okay, down to the anus, then discard. Do not back and forth the cotton. Okay, then get another one, okay, as long as or until it is thoroughly clean. So clean, okay, then down until thoroughly clean, then discard. Okay? The next one is get another one. Okay? Using the figure of 7. Okay? So mons pubis, here from here in the groin, going to the mons pubis 7, going to the anus. So that is using the figure of 7. And get another until it is thoroughly clean. Okay? So do it until the patient's bulbar area is thoroughly clean. Then on the other side, inverted 7. Okay? So you see, it is the cleaning should touch the mons pubis, going to the this is the labia majora, this is the labia minora. Okay? So, halimbawa, figure of 7, okay, mons pubis going to the labia majora, the labia minora, the inner part, and then going to the anus. Okay? So if it is not yet thoroughly clean, then repeat the procedure. Or just do it like this. And then to completely clean the area. And then include the growing part, this one, going out. Same thing with this. Or like this. And this one. So that's how we clean the cranial area. So figure of 7. Or you can use your hands or this forceps. But if you use your hands, so just the same. Figure of 7. Okay? Then going down, going to the labia majora, then to the labia minora. Minora is in the inner part. Then going to the anus, then do not touch the bedpan. Then this part. Then 3 strokes. No? 1 stroke, 1 cotton ball. Okay, then the inverted one, just the same. Then this part. Okay. Nail. Then put down fold the blanket downward, exposing the genitalia of the male. Then get a towelette, wash and drain. Do not forget to check for the temperature of the water. Then fold it. Then holding the shaft, so you're going to cover the shaft. This is the shaft. Okay. Going to cover the shaft, exposing the head of the penis. Okay. So hold it like this. Then get the cotton balls. get the cotton balls, squeeze, then clean the head of the shaft. Okay, clean the head around, so single stroke only, then discard, then get another cotton balls, then repeat until it is already clean. Okay? Okay, just repeat until it is thoroughly clean. And then get cotton buds. Okay, dip the cotton buds, both tip, in the water. Okay, then clean the tip of the shaft of the penis. So do not retract the patient's penis, because it can stimulate. It will stimulate, and then alam niyo na kasunod. Okay, so just clean the tip, then the other one, repeat until thoroughly clean. Then get another cotton buds, wet the cotton buds, and then clean the creases. Okay, then discard. Patient is uncircumcised, so you have to retract gently the foreskin of the patient. Okay, retract gently, and then clean it with cotton balls. Okay, because you know already that this is the dirtiest part of the male. Okay, then discard, then get another one. That's it. Then repeat it thoroughly until the patient's penis is clean. Then get another cotton buds, then clean the scrotum downward, horizontal. Okay, so clean the creases and folds. Okay, then discard. Repeat the procedure until it is thoroughly clean. Then with the towelette, then in downward manner, so you have to wipe the patient's penis. That's it. After the perineal care, so you're going to remove the bedpan. In removing the bedpan, so you're going to put down the blanket, and then ask the patient to move upward his pelvic area. Sir, in the count of 3, please move up your pelvic area and then pull the bedpan. 1, 2, 3, up. And then go and then wash. If the patient is with catheter, so you're going to check first the catheter for the patency. So if the patient's catheter is good flowing with urine, you will see the output in the urine bank. Okay. So check first for the patency. So you will see the urine is smoothly flowing, going down to the urinary bag. So this is the urinary bag. So in checking for the urine output, so you're going to check for the level of the urine. So check how many output the patients have. Okay. So if the patient's output is 500 cc, so you're going to document it, and then the consistency, the color of the urine. Okay, in removing the urine from the bag, so you're going to use the urinal. Okay, just pull gently the tip of the urine bag. Okay, so when you pull it down, okay, then the urine will go out of the urine bag. Okay? And then, return the cap again by pulling it up. So just pull down, open, pull up, close. So just be sure that the urine bag is closed. Okay? And then clean the tip of the catheter. Again, check for the swelling, irritation, and the placement of the catheter. Okay? So you're going to clean the base of the catheter. Okay? Here, the base of the catheter up the base. Okay, just wipe the catheter or the hose. Okay, wipe it. So that is how you care for the catheter. And then check for if it is loosening, so you can place a tape in the patient's legs. And then if you see that there is a problem in the patency of the patient's catheter, just if there is problem with the patency of the urine in the catheter, just bend the hose and then try to give a pressure and then remove. And then check if the urine is flowing. So if you cannot do it, then call the attention of the nurse or the doctor. After disposing the feces in the bathroom, then you're going to place the patient into its original position, which is the supine position. So, sir, I will put down your legs, then count to 3. 1, 2, 3. So from dorsal recumbent to supine position. Wait, in the count of 3, 1, 2, 3. And then, so from semi-folders, so you will put down the bed to supine position. Move your gloves. So, sir, we're going to shampoo your head, your hair. So, in shampooing, you'll be using the shampoo, cotton balls, black towels, and towelette. Okay. So, sir, I'm going to remove your pillow. At the count of 3, say 1, 2, 3. Sir, I will position you diagonally. Okay? At the count of 3, please help me. Okay, going to your right. Okay, 1, 2, 3. Then the leg part. Then this is the belly pad. So you'll be using the belly pad. So the belly pad must be inflated. But it is okay if your belly pad is not inflated. Okay? You will put it underneath the patient's head. Okay, sir. At the count of 3, I will put the belly pad. 1, 2, 3. So the belly pad tip must be, or tail, must be in the pail. So that the water will be directly going to the pail. And then you will put underneath the nape the towel. Sir, I will put the towel. 1, 2, 3. Then across to the patient's chest. Okay. Then put the blindfold to your patient so that the eyes will not with bubbles of the shampoo, and then cotton balls to the ears so that it will not, the ears will not have water. Okay. Then assess the head of your client. Check for the wound, irritation, or swelling before getting wet the hair. So if the head of the client is okay and normal, so you can, the caliper is not inflated, so you can put another towel, folded towel, to the patient's head. Okay, sir, I will put another towel to your head. 1, 2, 3. Okay, so check for the assess the head of the patient for the swelling, irritation, or lice or dandruff. So if the patient's head is normal or healthy, then you can proceed with the wetting of the hair. Okay, so get water. Check if the temperature of the water is not too hot or not too cold. Then wet. After that, apply shampoo. Enough shampoo, then lather it. Then apply to the hair of your patient. So you have to massage the patient's head from inner, okay, inner to outer. Okay? Okay? Going to the side, to the occiput. Okay? And then after that, you will rinse the hair of the patient. Rinse. Lift the head so that it will be rinsed in the part which is the occiput. Okay. After that, so you're going to wipe the patient's hair. So remove the blindfold and the cotton, and then put the towel on the head of the patient, and then remove the towel, remove the caliper, and then position the patient to its original position. 1, 2, 3, sir. Center, and then the foot part. In your face. So I will get the big towel, put it across the patient's chest. Then check the water if it is not too hot or not too cold. Then get the towelette. Then wash and drain. So you can use the soap. Okay. Then wash and do the hand mitten fold. So first you're going to clean the eyes. So start first with the eyes away from you. Okay? So here, this one. Away from you. From inner canthus to the outer canthus. Upper, inner canthus. So ito yung upper. This is the inner canthus to the outer canthus. So the eyes away from you. Use the 4 corners of this towel. So from here, this side, inner canthus to the outer canthus of the upper eye. Then the next one is this corner, inner canthus to the outer canthus. Then, the other side, inner upper canthus to the outer canthus. Then, the inner canthus to the outer canthus of the lower eye. So, like that. So, nakuha? Okay? So, start with the eyes away from you. So, this is the eye. So, using the four corners of your cowilet, so start with the inner canthus to the outer canthus. Upper. Inner canthus to outer canthus. Then, then the other side. Then, wash and ring. Then, next is the nose, the bridge of the nose. So, include the creases, the side of the nose. So, this one, and then this one, and then this one. Okay? Then, wash and fold. Wash and ring. Then, do the hand-beaded fold. Then, clean the upper lip. Then, clean the upper lip. Then, the lower lip. Okay? Ito. Then, ito. Okay? Then, wash and ring. Then, do the hand-beaded fold. Then, do the figure of 3 for washing the face. Start from the forehead. Okay? Figure of 3. 1, 2, going to the chin. Okay? Then this side, 1, 2, and then 3. So that is the figure of 3. Okay, I repeat. So wash tayo ha. Wash and ring. Then the figure, do the figure of 3 for the face. Okay. From start to the forehead, going to the cheek, going to the chin. Then the other side, from the forehead to the cheek to the chin. In the face, then get a dry towelette and then pat dry the face. Okay? Undressing the upper extremities. Okay, so mom, sir, you're going to remove your dress. Okay, in removing the dress, so you have to put the patients in lateral position. So in doing the lateral position, you have to put the hands of one hand of the patient in the chest, okay, and then one leg across, okay, and then abduct the patient's arm going, so abduct, you see abduct going towards you. Sir, in the count of 3, I will put you into the lateral position. 1, 2, 3. So make sure that the patient is holding the rails, the side rails. And then remove or untie the gown. Okay, untie the gown in the back. Okay, after untying, then sir, I will put you on your original position. Okay, at the count of 3, 1, 2, 3. Then, start with the unaffected hand. So, this is the unaffected hand. So, remove the gown. Why on the unaffected? Because you can already fold the hand or move the hand. So, yan. And then, the other one. then it is already loosened with the affected area. The clothes is already loosened with the affected area. To remove it. And then from underneath, you're going to remove the gown without removing the towel. Then, put the gown on the laundry bin. So, next is cleaning the upper extremities. In cleaning the upper extremities, so we need the 4 basins. So, why 4 basins? So, we need for water for rinsing or wetting the patient's extremities, then for soaping, then for rinsing, and then another basin for soaping the hands. Okay, so we have the towel, the soap, and the 4 towelettes. Okay, so first, before I proceed with the procedure, I'm going to explain the LAPM method. So what is the LAPM method? So the LAPM method, L starts for lateral. So this is the lateral. You know already, side. This is the lateral. Okay? Lateral method is proximal to distal. So in wiping the patient's body and the patient's extremities, you will start from proximal to distal. So paganon. Okay? Next is the anterior. Anterior is this one. From proximal also to distal. Okay? And then the posterior. Posterior is the back. Okay? From proximal to distal also. Okay? And then the medial, which is included your axilla. So the method here is from distal to proximal. Okay? Why? Because axilla is considered the dirtiest part of your extremities. So you know already what is LAPM method. Okay? So let us proceed with the cleaning of the upper extremities. First, you will start with the hands or extremity away from you. Okay? So you will put underneath his arm a big towel. Okay? Expose first the extremities away from you. Then put underneath the big towel. Then get the hand, the towelette. Then wet the part. Okay, so wash and wring. Then wet. Do the hand mitten fold. And then wet the lateral part of the extremity. This is the lateral part, okay, up to the digits of the hands. And then wash and wring. Then continue with the wetting of the hand using the LAPM method. So from the lateral, going to from proximal to distal, including the fingers. Then the anterior part, from proximal to distal, going to the digits of the hands. And then from posterior to from proximal to distal, going to the fingers of the hands. And then the medial part, from distal to proximal. Okay? And do the LAPM method. Then, get another towelette. Wash and wring. Put soap. Okay, with soap. Then, do also the LAPM method. So, just do the same procedure. So, LAPM, from lateral Okay, lateral to posterior to distal, then the anterior proximal to distal, then the posterior proximal to distal, then the medial from distal to proximal. So do not forget to include the finger. Okay, pay attention to the digits of the hands because the dirt is in between the digit of the hands. And then next is rinsing. In rinsing, just the same, wash and rinse. And then begin also by using the LAPM method. Okay? So you know already the LAPM from lateral, so proximal to distal, then anterior proximal to distal, then posterior proximal to distal, and then the medial from distal to proximal. Okay? And then get the water, and then rinse the hands. Okay? Rinse the hand. Pay attention to the digits of the hand. Okay? And then pat it dry using the towel underneath the patient's extremity. Okay, so cleaning, next is cleaning the neck area. So expose the neck area. So just get the, so we will only be needing the 3 basins. So water for wetting, for soaking, and for rinsing. So get the towelette. So wet with water, rinse and wring, and then do the hand kneaded fold. So wet the neck area. In wetting the neck area, you have to start in the middle, in the medial part. In circular motion, going to the lateral. So in circular motion, going to the lateral, this is the lateral, going to the back of the nape. Okay, include the back of the nape in circular motion. Then on the other side, do it on the same manner. So from medial, going to the lateral side, going to the back of the nape in circular motion. Then do the same in the soaping. Then soap. Do the hand kneaded fold. Do the same procedure. So from medial to lateral to the nape. Do it on the same side. Then rinsing. Rinse and wring, then do the hand kneaded fold, then the same procedure from the needle going to the lateral, going to the back of the nape, then do the same procedure to the other side. Okay? Then pat it dry. Cleaning the upper chest. Okay, in cleaning the upper chest, you're going to expose the upper chest. Expose the upper chest without exposing the breast. Okay? So just the same procedure. So rinse with or wetting the patient's chest by using the same procedure from medial to lateral. Okay? So rinse and wring, and then do the hand kneaded fold. Okay. Do the hand kneaded fold from medial to lateral in circular motion. Include the clavicle. Okay, to lateral. Okay. So on the other part, from medial, from this side, medial, going to the lateral side. Okay? Then soaping, do the same, rinse and wring, then do the hand kneaded fold, then soap. So from medial to lateral, going to the side. Then to the next other corner, from medial to lateral in circular motion. Then rinsing, just the same method. So do the hand needle fold, then from medial to lateral in circular manner. Then the other side. Then pat it dry. Then we will proceed with the cleaning of the breast area. So before you clean the breast area, inform first the client. Okay, ma'am, I'm going to clean your breast. Okay, so if it is okay with the patient, because breast is a very private part, so we have to understand that we have to inform first the client. So expose the breast one at a time. Okay, so lift the drape and then expose the one side of the breast, and then get a cotton balls. Get the cotton balls, wet the cotton balls, and then clean from the areola, clean from the nipple, then to areola in circular motion. So from the nipple, okay, in circular manner out of the areola, like this. So clean, repeat until thoroughly clean. So clean the nipple, okay, going out, inner to outer, in circular motion. Okay. Then part, expose. Then get another cotton balls, clean the nipple, then outer part, the areola, from inner to outer. Discard. While cleaning for the patient's breast, take down notes also if the patient's assess for the patient's breast if there is a wound, irritation, or redness of the breast. Then, after the breast, so we're going to clean the lower chest. In exposing the lower chest, so we're going up, hindi naman kasi nilagay ko, sinisipon. Okay, so roll up the towel and exposing the lower chest. So lift up the breast if it is Then exposing the lower chest, so we're going to clean it with rinse with wet the part with water. Do the hand needle fold. Then from medial to lateral, from the cleavage going to the lateral side underneath the breast, under the breast. Okay, from the cleavage going to the in circular motion going to the lateral side. And with the other corner of the towel from the cleavage go under the breast going to the lateral side in circular motion. So do the same in soaping the patient's lower breast. So you have to do the hand needle fold from the cleavage again under the breast going to the lateral side, then the corner going to the other side. Do the same procedure, and then rinsing with water. So do the hand needle fold, do the rinsing by from here, from the medial part, which is your cleavage, underneath the breast going to the lateral side, then the other corner of the towel using the same procedure on this side. Then pat it dry. Then cover the area. abdominal area. So you have to expose the abdominal area. Then check for the navel. So navel is yung pusod. So check if there is irritation, redness, or any sign of inflammation. So if there is none, then you can proceed with the cleaning. So if there is irritation or wound in the navel area, you can clean it with cotton buds with betadine in circular motion. Okay, so if there's no irritation, then you can proceed with the cleaning of the navel. In cleaning the navel, get the cotton buds. Okay, so get the cotton buds. So wet it with water, and then from inner to outer. Okay, from inner to outer. Okay, then the other side, from inner to outer. Okay, until it is thoroughly clean. Then proceed with the wetting of the abdominal area. So rinse and drain. Then do the hand needle fold. So just the same procedure from medial to lateral in circular motion. So from medial to lateral. So yan, hanggang sa side. Okay? And then the other corner, doing the same procedure from medial to lateral. Okay? So then the soaping, just the same procedure. Do the hand needle fold from medial to lateral. Then the other side. Then the rinsing from medial to lateral din ang ating procedure. Okay, do the hand needle fold from medial to lateral. Then the other side. Then it's done. Then pat it dry. Pat it dry. Then cover the area. After cleansing the abdomen, so you're going to turn to the patient's other arm, which is near you. Okay? Remember, we first do the arm away from you, going to the neck, going to the upper chest, then the breast, then the lower chest, then the abdomen, and then now we're going to proceed with the other arm. So in cleansing the other arm, just the same procedure, using the LAPM method. So we're going to put under the patient's arm, the towel. Okay. Then the LAPM method, so we have to wet the extremity from lateral, okay, to from proximal to distal, okay, in circular manner, and then the posterior, the anterior pala, going to the distal, and then the posterior, okay, include the digits of the hands, ha, and then from distal, from the medial, yung medial naman, from distal to proximal, okay, so that is. So then the soaping, just the same, do the hand needle fold, do the LAPM method, and then, so, ganun din, okay, tapos yung anterior, tapos yung medial, okay, so then rinsing, LAPM method again, from lateral, proximal to distal, then anterior, then the posterior, then the medial, okay. Tapos, pat dry. So you can pat it dry by other towelette or using this one. Okay, then I forgot another towel, and then soak the digits of the hands, the fingers, then clean. Pay attention to the interdigits of the hands. Okay. Then pat it dry. Then cover it with towel. extremities. So, again, start the cleaning of the lower extremities away from you. Okay? So, first, you're going to inform the client that you're going to clean the lower extremities. Remember to do not expose the genital area of your patient because it is included in your lower part of your body, the genital area. So, avoid exposing the genital area. So, first, you're going to ask the patient to a dorsal recumbent position of the other extremity, the one that you will clean. Okay, sir, at the count of 3, I will flex your legs. Okay, your left leg. Okay, so 1, 2, 3. Flex. Dorsal recumbent position. Pero isa lang leg. And then, put the towel underneath. Okay. The towel. And then, return to its original position. Sir, at the count of 3, I will put down your legs. 1, 2, 3. And then, expose the area to be clean. Okay? So, remember not to expose the genital area. So, nakaganyan. Okay? So, just the same procedure with the upper extremities, you're going to use the LAPM. So, for the legs, so the lateral side, okay, this is the lateral side, then the anterior part, then the posterior part, and then the medial part, ito. Okay, so just the same procedure. Lateral, posterior to distal, anterior, posterior, proximal to distal, posterior, proximal to distal, and the medial from distal to proximal. Okay, so first again, you're going to wet the patient's leg. Okay, wet. Do the hand-knitted fold. Then, from here, sa lateral side, going down, include the patellar area, going to the posterior, distal part. Okay? Then, sa anterior, okay? Then, the posterior, okay? Then, the medial. Okay? Then, the soaping. Soaping, the same procedure. Okay? Do the hand-knitted fold. So, lateral, anterior, posterior. Sa posterior, include nyo rin yung, itong may, dito, itong sa likod ng, buhol. Okay, and then, dito sa medial. Okay, and then, rinsing. Do the hand-knitted fold, the LAPM method. Okay. And then the last one is the soaking of the foot. Kasama din sa dito. Then the foot. Okay, remember to pay attention to the digits of the toes. And pat it dry. So pat it dry. Then, ito. I-cover ito. Pwede. Okay. Do the same procedure to the other legs. Okay? Okay, so next is the cleaning of the back. In cleaning of the back, be sure that the patient, you have to apply again the side rails because you're going to roll down the patient into side-lying position. So, in side-lying position, so be sure that the side rails is locked so that the patient will not get down or fall. Okay. So, So just the same procedure with the going to the lateral side of the patient. So do the lag roll technique. So in lag roll technique, so yung sinabi ko sa inyo, flex the arms, no? And then the legs. Okay, cross the legs, and then pull the patients towards you or abduct the patients towards you. Okay, 1, 2, 3. Sir, I'm going to put you on side lying position. Okay, in the count of 3, 1, 2, 3. So yeah, be sure that the patient is holding the side rails. Okay, so that he will not get down the bed. Okay, then expose the back of the patient. Check for any bed sore or any irritation or inflammation on the back of the patient. If there is one, then you have to clean it with betadine or plain NSS or the 0.9 NaCl. So, yun ang pinanglilinis sa mga bed sore. So, kung wala naman, then proceed with the cleaning of the back. If there is one, then you have to put gloves in cleaning the wound. Okay, so if there is not one, okay, so proceed with the cleaning of the back. So, in cleaning of the back, just the same procedure, okay? In rotating manner din yung ating pag-massage. Kasi bakit rotating manner? Baka magtaka kayong why it is in rotating manner. It is in rotating manner so that you will improve the circulation of the patient. In that way, parang minamassage nyo na rin ang inyong patient. So first, you're going to, so sir, please hold the, okay, it's just the same, wetting din tayo, and then, rinse and fold, do the hand, mitten, and then from neck, going down the pelvic area. Okay? Ganyan, kasi nalinis nyo na naman yung mga side na yan eh. Okay? So, paikot, okay? In rotating manner, up to here. Okay? So, yun. Tapos, do the soaping, do the hand mitten fold. Okay? Kung nakaka-hand mitten fold na yan. Ganun din. Okay? Ganon. And then, rinsing, do the hand mitten fold. Rinse. Okay? Just the same procedure. And then, pat it dry. Okay. So, to avoid soiling of your bed, so you can put another towel to avoid soiling of the linen. If in case you're not going to change the bed linen, if you are going to change the bed linen, then no need to put another towel. So kung malinis pa naman ang bed linen ninyo, then you can put a towel so that it will not get soiled. Okay? So then proceed, then put the patient in its original position. Sir, I'm going to put you down into your original position. To the count of 3, 1, 2, 3. Okay. Is dressing the lower extremities of the patient. In dressing the lower extremities of the patient, so you have to put the patient in dorsal recumbent position and put on the pajama on the affected part first. So, sir, I'm going to put you into a dorsal recumbent position. So, at the count of 3, so you will flex your left leg. Okay, 1, 2, 3. Then the other legs are 1, 2, 3. And then put on the pajama. So affected part first. Okay, up to the ano. And then the other side. Waist of the patient. Okay. Up to the waist. Then finish na. Sir, I will pull your pajama up to your hips. If you can lift your hips, then on the count of 3, 1, 2, 3, look. Okay? So, yan. And then, put down your legs. At the count of 3, 1, 2, 3. Then, at the count of 3, 1, 2, 3. And then, we will remove the top sheet. Sir, ma'am, I'm going to put your clean gown. So I will put your gown. So place the gown on top of the patient's body, and then start with the arm, which is affected area. So if the affected area is the right, so you have to put it first. Then the other side. And then remove the towel underneath. Then put it in the laundry bin. And then tie the gown. Okay, sir. I'm going to tie your gown. So you're going to do the side lying position again. Okay? In the count of 3 na, sir. Okay, I will put this to your chest. And then, yan. Okay. At the count of 3, sir. 1, 2, 3. And, tapos tie the gown. On your original position, 1, 2, 3. Okay. I'm going to proceed with the bed making of occupied bed. Then you can proceed with the proper grooming. But if you're going to change the bed for bed making, so you just do the occupied bed, not occupied bed. So, bed making. So, you already know the occupied bedding, so I will not demonstrate to you the occupied bed making. So, we'll proceed with the good grooming. So, in good grooming, so you remove the towel, and then apply so whatever. So, you're going to comb his hair, okay? Put lotion, okay, cologne, okay, and then powder, okay. So if the patient is a woman, then you can put lipstick, light lipstick, and then put the okay, 1, 2, 3. Okay, sir. How do you feel now, sir? Oh, great. Also, you have to put another blanket for the patient. Blue blanket. Okay. So, do the hand meter, go up, tapos sa hand. nagpalit tayo ng miter. Yan. Insert. So, ito yung triangle